Udah rame? Berapa orang? Oh, udah. Ya, udah mulai masuk. Oke. So we're going to start. Yeah. Okay. Okay. Let me be in the center stage. Selamat pagi. Good morning, everyone. Good. Oh, menghadapnya ke sana ya. Oh, I need to see that camera, not this one. Okay. So okay. Let me start again. Selamat pagi. Good morning, everyone in Indonesia, in Depok, in Jakarta, and maybe other cities. Good evening, Beverly and Sabrina in Boulder, Colorado. Okay, let me introduce myself first. My name is Diki Pelupesi. I'm the moderator for this morning for today's presentation, research talk, that we are so grateful and we are so privileged to have actually four of us, no, not four of us, four presenters. Two are online and two are here on site. So before we listen to the presentation, I'd like to first introduce the presenters. We have Beverly Kingston, Dr. Beverly Kingston. She is the director and senior associates of the Center for Study and Prevention of Violence at the Institute of Behavioral Science at the University of Colorado in Boulder. And we have also Sabrina Mattson, Dr. Sabrina Mattson. She is the research director and also senior research associate of the Center for the Study and Prevention of Violence at the Institute of Behavioral Science, University of Colorado in Boulder. They join us online, but we also have our discussion on site, offline, together with us here at the beautiful campus in a beautiful Friday morning. It's a sunny day here in Depok in Indonesia. We have first Jody Witt. Let me read your role, Jody. Jody is now the what do you call it? Director of Operation for the Center for the Study and Prevention of Violence, also from the University of Colorado in Boulder. And we have also here Francisca Zenhausen. Selamat pagi, because I know you can, yeah, you can speak. Selamat pagi. Okay. Francisca, also from the Center for the Study and Prevention of Violence, also from the University of Colorado in Boulder. What is your role, Francis? Manager for School Training and Support. So I'd like to also welcome all the participants attending this research talk and presentation online and also offline. Here we have some people offline coming to this research day online and also offline. To start, I'd like to give you a short introduction, maybe why we have Beverly, Sabrina, Jody, and Francisca with us today that we, Faculty of Psychology at Universitas Indonesia, we do have a research collaboration with a Center for the Study and Prevention of Violence, and also some other counterpart from Denmark, and also here in Indonesia, we have also our colleagues from Universitas Syah Kuala in Banda Aceh. And we are now implementing an adaptation, an adaptation of a model of intervention developed by Center for the Study and Prevention of Violence. So we can imagine that this program, this model of intervention, initially started developed in the US, and then it's been more than a year. We are now adapting, and then we'll implement later on the so-called Safe Communities, Safe School project. So that's how we connected with Beverly, Sabrina, Jody, and Francisca. I'm also part of the research project. We have also here Dimas as one of the researchers from us, from Universitas Indonesia, and Amelia, research assistant. So that's how we connected. And then I think this morning is a very a good opportunity, whoever for us to listen what's been implemented, what's been evaluated in the US regarding comprehensive approach to school safety. So I know if you are interested more in looking at, in reading, and trying to understand what is the comprehensive approach to school safety, there are some articles, some readings that you can also find and then read more. But I think this morning it is very fortunate for us that we can directly listen, and then Beverly and Sabrina, and also Jody and Francisca will share with us their experiences and some of the lessons learned from implementing this school safety project or program. Okay, without further ado, I'll hand over this session to Beverly and Sabrina. Please, you may start, Beverly and Sabrina. Thank you.
Thank you so much, Dickie, and thank you all for having us. We're really honored to be presenting to you this morning and this evening here for us. So, Dickie, that was a wonderful introduction about our project, and I'm just going to slides real quick because I was going to give something very similar about what we just covered that. So, we're here because we have this wonderful collaboration with the two universities in Indonesia, and this is the formal title of the project that that we're working on, and that's what Jody and Francisca are here. The overall name of the project is Addressing the Well-Being and Security Needs of Urban Children and Adolescents in Indonesia in the digital era. And as Dickie said, it's an adaptation of the Safe Community, Safe Schools model. So mostly I'll be talking about the Safe Community, Safe Schools model, but we wanted to give you that background. And here's more information about the goals of the project, the adaptation with Indonesia. So we're adapting and implementing this model in two cities, so Depok and Banda Aceh, and we're working with two schools in each of those locations, and we are targeting overall 4,000 to 6,000 students ages 10 to 15 and their families, with a reach of, we're aiming at for 24 to 30,000. And then hoping that, it adapts well, and then it can get spread from there. So now I'm going to turn back or forward or whatever to, or I guess back, because I'm talking about the study that happened in the past, I'm going to be talking, this presentation is going to be about our Safe Community, Safe Schools study that happened in the US, between the years of 2016 and 2020. And this study was funded by the National Institute of Justice, and what we're presenting today is not necessarily their opinions, but it's our views as the research team. So this is our disclaimer slide. And this was the project team. It was a really extensive team. This project was a $6.2 million grant. The study was over 4 years, but we did have the funding for 5 years, just to kind of close everything out. And so this is what I'm going to be talking about. This is the overall goals of this presentation today. So I'm going to start with defining a comprehensive approach to school safety and kind of getting that out there, what that is. Then I'm going to go into more detail of describing what is the Safe Community, Safe Schools model. I'm going to provide an overview of our National Institute of Justice study, which is the randomized trial. So I'll be talking about the methods and just that overview of the study. Then we'll talk about the findings in 3 different areas: readiness, implementation, and the outcome findings. And we'll end by sharing the conclusions, limitations, and lessons learned from that study. Start, like I said, by defining a comprehensive approach to school safety. What we know is that research consistently finds that a comprehensive approach to school safety offers the greatest potential for preventing youth violence and promoting mental and behavioral health. But people don't always know what do we even mean when we're talking about a comprehensive approach to school safety. So this next slide tries to break it down into, what are we talking about here? And a comprehensive approach to school safety addresses the key malleable risk and protective factors for violence and violence related to violence that happens at schools. It creates a positive school climate. It assesses school climate and students' mental health needs. It uses a multi-tiered system of supports to implement evidence-based programs. And what we mean by that, I don't know if you use this term in Indonesia, but by multi-tiered system of supports, we mean supports for all kids, like at the universal level, supports for those that are at risk for violence, and supports that for students that are already exhibiting violent or other types of problem behaviors. And so we want to create this evidence-based multi-tiered system of supports at all 3 of those tiers to meet those needs of students and staff at all 3 of those levels. And a comprehensive approach to school safety also includes systems planning and integration. So it really means not just working within, it means systems within the school and the district, within the school and other institutions that also support the school. Also that's kind of why we have the name Safe Community, Safe Schools, because, the problems might be seen at school, but they're whole system kind of issues. And so we need that to address those concerns. Okay, so there's also some challenges, and this is what we've seen over the many years doing this work, that schools are challenged with both understanding and balancing all the different aspects to a comprehensive approach to school safety. It's especially difficult for schools to balance like all the demands of what they have to do every day to teach children, along and their time demands, along with all the different requirements of a comprehensive approach to school safety. And when we did the study, it was before the pandemic, and we already saw back then that it was really like doing school safety work in the way that research said to do it was really challenging for schools. And we've been learning when we talk to our school partners now that the challenges are even more intense. The Safe Community, Safe Schools model and our research findings that I'm going to describe today aim to address those challenges. So now I'm going to switch gears a little bit to describe the Safe Community, Safe Schools model. And this publication as Dickie mentioned, we have a few publications from the study that we just did. And this one was an earlier publication from 2018, where we aimed to define those different elements of a comprehensive approach to school safety. And then we also studied readiness of schools to implement the comprehensive approach. And then this next publication talks about building the social and emotional capacity of adults to collaborate, to do violence prevention and school safety work, and to effectively support students' needs. So the Safe Community, Safe Schools model seeks to build comprehensive systems for safety and violence prevention and enhance positive school climate. The model was first developed in 2000 after the Columbine High School shooting. And we describe it as the model as being comprehensive, actionable, and individualized to each school's unique context. As you'll hear in the presentation, there's things that we want every school to do, but how it unfolds is individualized based on the school's needs. And it supports schools to understand and effectively implement evidence-based programs and strategies that are matched to their needs. So we really try to look at programs that have the best evidence, the best available research that show they're effective, but that also match the unique context of the school. And my experiences, which is, it's a while, I've worked with schools and communities for a long time now, is that, there's things that are common, but they're really, every place, every group, every team that you work with is unique as well. And so it's really important to have an approach that is flexible in that way. So the comprehensive approach works on what we call school safety systems. And the slide illustrates 5 different school safety systems. And I'm just gonna show you them here on this slide, but then I'm gonna go in a little bit more depth into each one. But these are when we're talking about this comprehensive approach and the different systems that we really trying to align and coordinate and integrate, it's these 5 systems. I'm going to go through, like I said, each of them one at a time. So the first one is culture, climate, and community. And here we're really emphasizing a focus on a positive school climate. We have many reports in the United States that, reports and research that show a positive school climate is foundational for work around school safety. I mean, it's just like the foundation. So we like to start with that one. Within this area, we focus on respectful relationships, and those respectful relationships are between staff and administrators, students and staff, students and students. So all the relationships and trying to make sure that they're respectful. We also here focus on staff self-care, making sure that the disciplinary policies and practices at the school are really clear, they're fairly enforced, they're not exclusionary policies. We also here focus on family and engagement as well. This area, mental and behavioral health. We want to make sure that there are universal practices to support mental health of the students in the schools. Some of what we mean there are things like making sure that the staff know how to identify mental health concerns, that the staff know how to support students who've experienced trauma. There's a big push around trauma-sensitive schools in the US, and that aligns really well with what we are trying to do with Safe Communities, Safe Schools, and it aligns well with positive school climate. In mental and behavioral health, we also want to look at, having screening and assessment processes that are effective. We want to understand and ideally increase and support staff capacity to address those mental health concerns, and that we want to make sure that we've got evidence-based interventions in place to support students' mental and behavioral. Sometimes those supports are at the school, other times that's where we make linkages to supports outside of the schools again, depends on. And then this is an area that I'm not sure if you are familiar with it all, but in the United States, we do a lot of work under what we call behavioral threat assessment and management processes and policies. It's been a big push in our country for, I would say over probably a good 20 years, if not longer. And what that is, behavioral threat assessment is a problem-solving approach to violence prevention that involves assessment and intervention for students that have threatened violence in some way. And what it seeks to do is to pull together a team. The team we say it really needs to be at least 3. And we aim to have a school administrator, someone who's got a counseling or mental health background, and someone in law enforcement. And they come together and when they've got someone who's made a threat, and they look at what happened. So they use the systematic process. There's a lot of training that's involved in this process. And they evaluate whether the threat is something that's, is just a threat that's made versus something that actually does pose a threat, that the student could actually do harm. And we call it behavioral threat assessment and management because we really aim to make this a supportive process where the student gets help and that they're monitored over time so that it doesn't turn into something that's violent. Under this area and related, we also want to make sure that there's training for students and staff. We call it, here we list it as bystander training, but what we mean by that is training to identify the warning signs for violence or, concerning behaviors. In the US, some of these warning signs are, escalating anger, they're being kind of obsessed with violence, certainly making threats, having firearms, being really overly concerned with firearms, but there are also things like being depressed or, issues over grades. So there's a range of what those look like, but students that we really need to be concerned of usually have a lot of these behaviors and they're seen over time. So we want to build processes where staff and students can report concerns, not in a way that is getting other kids in trouble. It's not about tattling or anything like that. It's about sharing concerns so that the kids, that's the way we see this. Last area of those 5 areas of the systems that we really focus on is information sharing. And this is something that is in our schools and communities, a big barrier. And we need to have really solid processes and policies for communication related to safety concerns. And this means that staff and students as well know, mostly we're talking about staff, but somewhat students too, know what information needs to be shared and to who it should be shared with. So the Safe Community, Safe Schools model is working on making change within the systems. The way we describe the model is we focus on 3 core components. The first core component is to engage schools. And we do that by developing a multidisciplinary school team at each school. And that team, they're the collective champions to implement the model. And the way it works in the US is that the teams meet at least monthly, and we being our staff, like Jody and Francisca, facilitate meetings with the school staff. And in this project, when we were doing it as a randomized trial, these meetings occurred at least monthly. And this team really aims to, they're like the implementers of the model in the school, but they are also focused on getting feedback from the rest of their school and promoting buy-in from the broader school and community. The second core component focuses on gathering data. And we collect that data in partnership with the school teams. And in this study and in our model, we collect data on readiness. And I'll go into more detail explaining what we mean by readiness. We collect climate surveys, so school climate surveys from students and staff. And we collect something called an action plan questionnaire. And that's a questionnaire that the school team, more than the school team, can take it as well. But that's where we assess those 5 systems that I just was talking about with that action plan questionnaire. So we understand like what does the school most need to work on within those systems? And then they can set priorities from there. And that's what they do. They basically look at their data, all the data from those different areas, and they prioritize what they want to work on. Our team really worked closely with the school team to help them set those priorities. And then from there, they develop and implement an action plan. And in this study that we did, a very big part of our study was for them to use the data to select a Blueprints evidence-based program. And the Blueprints programs, they're basically, the Blueprints is a registry of evidence-based programs. We can give you the link for that registry that have the highest rigor in terms of their being reviewed from evaluation. So they've got multiple randomized trials to show they're effective. And so a big part of the study was to make sure that the schools prioritized their data. Then they selected and implemented a Blueprint program, as well as other strategies. So it was the Blueprint program and other strategies matched to their needs. So I'm gonna now kind of move to talking about readiness, because readiness is such a big part of the work that we do. And it's really important when you are implementing something new to consider the readiness of the organization to make the change that we're talking about. So here we're talking about in our project, we were talking about the school's readiness to implement this innovation, which for them was the Safe Communities, Safe Schools model. And then it also was the readiness to implement some of the programs in their school action plan. And one other thing with the action plan that I'll say is that the action plan also focuses a lot on supporting the implementation. So it's not just a plan that sits on the shelf. And so what we want to make sure is that schools are ready to take on, what they're wanting to do, and so that it matches their readiness. And we use a research-based definition of readiness. This definition was developed by Jonathan Scatia and Abe Wandersman, and we can give you some of the citations with this as well. And this readiness is measured by 3 different dimensions, and each of these dimensions can be measured and improved on. And this is a heuristic to help you understand, what we're talking about. So the R in this equation stands for readiness. The M stands for motivation. So by motivation, we're talking about the willingness to buy into and support the initiative. So how willing are they to do something that's a comprehensive approach to school safety? That's what we're talking about with Safe Communities, Safe Schools. And we know that nothing's going to get implemented if people don't want to do it. The C is C squared, and both of the first C that I'll be talking about represents general capacity. And general capacity refers to the attributes of a functioning organization, like their resources, the capacity of their leadership, their staffing capacity. It has to do with how much time do they have, that kind of stuff. So a school could have a lot of motivation. They want to implement a program, but if they're under-resourced and they don't have the time or the skills needed, implementation won't happen for that reason. And the second C stands for another capacity, but this one is called innovation-specific capacity. And that refers to capacities that are needed to implement the new program and to implement that new program with quality. So in our study, like I said, the innovation-specific capacity that we were trying to gear them up to was to have the capacities to implement the Safe Communities, Safe Schools model. So the next set of slides is going to go into details about the study, which, as I said, was a randomized trial of the Safe Schools model. And this is a with the results from that study all written up, so you can refer to that. more information, and I'm going to go through the findings as I present today. So here's our study design. Our purpose was to evaluate both the feasibility and impact of the Safe Community, Safe Schools model using a staggered entry randomized controlled trial. And our sample was 46 Colorado middle schools. And we had 3 research questions. The first had to do with readiness. And it was, do schools increase their readiness to implement the Safe Community, Safe Schools model over time? The second was a question about implementation. Is the Safe Community, Safe Schools model implemented as intended in the participating schools? And the third question is about the outcomes. So what's the effect of the Safe Community, Safe Schools model on school climate, on safety, on behavioral and mental health issues, and on academic outcomes? So we looked at all of that. It's a very big study. I don't know. I think I might have said the funding was $6 million. So it was a big project with a big team with lots of research questions. And actually, what the next slide is. So we worked with 200 school team members. We had 46 teams basically. We offered 15 trainings in a variety of different areas, including like trauma-informed strategies, behavioral threat assessment, training in the Blueprints programs. We administered our staff climate surveys to over 3,000 school staff, and we administered our student climate surveys to over 30,000 students. Big study. It was really, really amazing to now look back on it. Okay, so this slide is about our study design and the school selection process. As I said, we've selected schools from Colorado's Front Range, and I know you don't know exactly where that is, but we focus on middle schools. And to start with, we did feasibility visits where we met with people from 60 schools, and the team that met with those people gave them a score. And that was their initial readiness score. And they needed to have at least a 5 out of 7 to qualify to be part of the study. 8 of those 60 schools did not meet the threshold. We selected 46 schools with the highest readiness scores. We waitlisted the other schools in case we had dropped, but we didn't end up needing to fold those in. And then our schools were matched in pairs by demographics, and they were randomly assigned to treatment or that waitlist control. And so I'm just going to run through our study design for each of the research questions. So for the first research question, which is that readiness question, we administered a 90-item readiness survey annually to the schools. And the readiness survey was only implemented with the schools in the treatment condition. And you can see the response rates were fairly high for the readiness survey. And then the implementation question, which is to conducted a process evaluation of the implementation, and we tracked that by implementation logs, classroom observations of the program. We administered mid-year and end-of-year program facilitator surveys, especially for those with the Blueprint program, the Blueprint evidence-based programs. And then we also conducted structured team interviews. And then for our third research question, which is the outcome question, what is the effect of the model and all those different measures? A variety of data. We used school data, attendancy, truancy, suspensions. We used student test scores, which we got from our state, and we used the student and staff climate surveys. One thing I will say, the student test scores were actually, I believe those were actually we tracked them by individual over time, but the climate surveys were whole school over time. So that data, when you're trying to change whole schools, and it was, different kids likely that took it, potentially different kids who took it, not for sure, but potentially. So that's challenging. But we had really good response rates in our climate surveys. For the student survey, we had 76%, the staff 72%. So now I'm going to cover the readiness and implementation findings. So this slide relates to that, to that first research question. Do schools increase their readiness to implement the Safe Community, Safe Schools model over time? And our scales measured those 3 dimensions of readiness that I described earlier. So motivation, general capacity, and innovation-specific capacity. And because of our staggered design, each school participated in the randomized study for only 2 years. So the overall study was 4 years, but the schools only participated for 2 years. So during this time of those 2 years, all the scale means for readiness increased in the expected direction or stayed about the same between years 1 and year 2. And 6 out of the 21 scales that we measured increased significantly. And here I show the results from the innovation-specific capacity scales. And we chose this slide to show because this is where, most of the significant changes were seen, which also makes sense because this was the area that's most directly tied to the implementation of Safe Community, Safe Schools. And here you can see significant increases in knowledge and skills, in innovation-specific leadership, which really relates to like that the school team's leadership to implement the model, and having a supportive climate for the innovation. So all of that increased over time. And then now I'm going to turn it over to implementation findings. And this is that second research question: was the Safe Community, Safe Schools model implemented as intended in participating schools? And here you can see 3 core components of the model. So healthy school team, collecting and using data to guide programming. And that was measured by 2 different questions. And then the third area is implementing the blueprint evidence-based program. And we used 70% as our fidelity cutoff score. And the implementation data showed that the majority of school teams implemented 2 of the core components with fidelity in year 1, which the evidence-based program was not implemented in year 1, so it actually doesn't even count. And 1 out of the 3 core components in year 2. So in year 2, healthy school teams was 57%, and implementation of the evidence-based program was at 65%, which was lower than that 70% threshold. But also, if any of you have studied implementation science, this was their first year of implementing a new evidence-based program. And these numbers are pretty normal for that first year of implementation. Okay, but I'm going to talk to you a little bit more about some of the challenges, some of the successes and challenges. So some of the successes, we also collected data from those monthly team meetings when our team was on site with the school teams. And during those meetings, we had really, really good results. So from those team meetings, 97% agreed that their partnership with Safe Community, Safe Schools contributed to a clearer understanding of their school's current supports and their needs. They said it built their school's capacity around prevention efforts, and they felt like their partnership with us helped improve their school's climate and culture. Also, at the very end of the project, we got feedback. We did feedback meetings with participating school team members, and it was a pretty big group. But I mean, of course, the ones maybe the less supportive teams didn't necessarily participate. So I would say it's a little bit biased, but it was a pretty big group, probably about half, for instance, or Jody could probably say exactly, but probably about half of the school teams participated in that. And we saw They reported, that they increases in collaboration, better decision-making processes, which has a lot to do with this. We have a very big focus in Safe Communities, Safe Schools on that data-based decision-making. So we collect the data so that the schools can really increase their capacity around understanding the data, setting priorities, tracking the results over time. Many schools reported better relationships with students and also valuing prevention. Some of the challenges that we experienced were that were reported, and this is a lot to do with the Blueprints program, but also overall, you can see how these would have affected some of those results in that second year of implementation. So we had staff turnover in four of our schools. So 4 of 23 principals changed, and 4 of the 23 school-based coordinators changed, and they were new in that second year. And schools also reported concerns about the relevance, the fit, and the perceived value of that evidence-based program. So even though we had gone to so much effort to really try to make sure that evidence-based program matched the needs of the schools, there were still some issues with that. And we learned a lot in that process, and are going to take some of that forward. So we'll talk about that more in the conclusion. I'm now going to hand it over to Dr. Arredondo Mattson to talk about the outcome findings.
Thank you, Beverly. I will cover the next few slides and talk about these findings. Next slide. So we found relatively few significant impacts of Safe Communities, Safe Schools on year 1 and year 2 staff and student school climate data. When we say outcomes on school climate surveys, students were asked about school climate indicators such as teacher support, respect for authority, respectful climate, positive feelings and attitudes towards school, and staff capacity to address mental health needs. We also asked about behavioral outcomes. This slide covers the behavioral outcomes. There were 4 significant outcomes out of 21 outcomes in total for student school climate data. Sorry, Beverly, you can go back to the last slide. And all were in the unexpected direction and all in year 2. There were 2 on peer norms. Peer acceptability of aggression increased, and peer encouragement of prosocial behaviors decreased. And 2 types of behaviors increased. Perpetration of aggression increased, and truancy increased. There were no significant impacts on staff climate data. Next slide, please. So the takeaway for staff and student school climate data is that there were no significant findings in the expected direction, and there were similar findings on school climate surveys for student and staff data in Safe Communities, Safe Schools versus waitlist control schools in both years. And it's important to note that these outcomes are more distal in our model and would be expected after 4 to 5 years. But we only had 2 years of data for this project to report on in this study. Next slide, please. There were no significant impacts on student attendance and truancy rates in years 1 and 2. Next slide, please. So the takeaway here is that students in Safe Communities, Safe Schools had similar attendance and truancy rates to students in the waitlist control group schools in both years. Next slide, please. There were some positive impacts on student suspension rates in year 1. We saw reduced year 1 total suspension rates and in-school suspension rates for students in Safe Communities, Safe Schools versus students in the waitlist control group. There were no differences in other outcomes, out of school and year 2 suspension rates. Next slide, please. So the takeaway here is that there were mixed impacts. There were positive impacts of safe communities, safe schools on total and in-school suspensions in year 1. And students in safe communities, safe schools had similar suspension rates to students in the waitlist control group schools in year 2. Next slide, please. Students in safe communities, safe schools had higher English language arts test scores, but similar math test scores than students in waitlist control schools. For academic achievement, we found mixed impacts of safe communities, safe schools on reading and math test scores in years 1 and 2. There were positive impacts on year 1's grade 7 and grade 8 reading test scores and year 2 grade 8 reading test scores. Non-significant impacts on year 1 grade 7 and grade 8 math test scores and year 2 grade 8 math test scores. We couldn't look at grade 7 math test scores in year 2 because of the analytic approach used. So the takeaway here is that there were positive impacts on English language arts for safe communities, safe school students, and similar math test scores for students in the waitlist control schools. Now I will turn it over to Dr. Kingston.
Beverly, I think you're still mute.
Okay, sorry about that.
Sorry.
It was too small in the corner. Okay, so I'm going to now talk about our study's conclusions, limitations, and lessons learned. Okay. So first, it's exciting to see increases in readiness and the adoption of the data-driven approach by the school-based teams. The school's successful adoption of a data-driven approach is really encouraging, as this has been highlighted, this kind of dimension has been highlighted as critical to success of other evidence-based programs. Second, we also experienced challenges in implementing the selected blueprints programs. And finally, the study's timeline limited our ability to see program effects that took longer than 1 to 2 years to materialize. So, in terms of our study limitations, as we've already said, the study length limited our ability to test the Safe Communities, Safe Schools impacts on the outcomes. And it was frustrating because we had to do this staggered design where we had a waitlist control, and then the waitlist control would roll in, into the treatment condition. So what we had wished so much is that we could have extended, to have actually a 4-year study, but this was one of our limitations. I mean, in terms of if we didn't give the model to the schools and let them, be a participant within that time period, I think it would have been really hard for us to get schools to sign on. And then we also didn't have the funding. So that was definitely a limitation, and future research should look at, looking at those longer term implementation and those longer term indicators that Sabrina was presenting on. The second limitation is that we didn't collect extensive information on the staff outcomes. So for example, like on how teacher morale may be impacted the project, or how the change process occurred for the staff. So, one of the things we really know that change happened on those teams, the teams that worked most closely with us. they got excited, there was motivation, and we started to see things, start to spread in the schools. But it'd be really interesting to look at network analysis in the future to understand like the sequential nature of the change, how change happens over time with these kinds of comprehensive efforts. In this work, like I started at the beginning, it's a comprehensive systems change model. So really being able to break down the study into these different chunks to see impacts would, I think, could be helpful. Could help. I mean, we see a little bit in our study with the readiness, but could help us understand how to develop these models even more. Another thing that is a potential limitation is the matching process for randomization was based on demographic characteristics, not on the prioritized challenges. So that could have affected the differences in the matched pairs, that their challenges could have been different, and they might not have. We limited our fidelity monitoring to, we still had a lot of fidelity monitoring, but there's more, especially with the Blueprints program, we limited it because to like at the 6 month, at mid-year and end of year, school year. But because we didn't want to burden the schools, when the schools are already burdened. But if we maybe could have given back information or understood some of those challenges with implementing the Blueprints program sooner, maybe we could have addressed things earlier. In the future, we learned some sort of more frequent data collection around implementation earlier would be good, as well as, developing some real innovative online tools that schools could use, like dashboards, could allow the schools to collect data and see their data in real time. That was one of the things one of our ambitions in this project, and we didn't get it. We wanted to have a data dashboard, but we didn't have the resources to fully develop it during the project. But we have some ideas for it. We started to develop out the questions and what it could look like. So that is a future project we'd love to grow. And maybe it'll come out of the Safe Community, Safe Schools adaptation in Indonesia. So I'm going to close with our lessons learned. And these are just some of the lessons, but there was many in such a big project like this. But first, we learned that assessing and addressing readiness with schools may be important to support implementation of a comprehensive approach to school safety. Looking at readiness can really help schools to address this complex work in manageable, or I don't know how this is going to translate, but or bite-sized chunks. Even with the implementation challenges we've experienced, we also saw that the school teams are essential to effective implementation of that comprehensive approach. The school teams are the champions and the change agents of the process. Third, we saw that data is valuable, but collection can be challenging. And, we found that it's so important to do everything possible to ease the burden of data collection for schools. And also, as part of our model, all the data we collected, we wanted it to be very usable to schools so that the schools didn't feel like, oh, we're just collecting data for a research project. All the data they collected was something that they can use for their own planning purposes. We also learned that this tailored approach to school safety is really important. It helps schools to gain buy-in, and it also helps sustainability of the project. It does this because it allows the work of school safety to fit in and enhance what schools are already doing. We say it's not adding more to their full plate. That's how we talk about it a lot. Then we also found in our project, and again, this was before the pandemic, that school staff needs emerged as essential to address alongside student needs. Common concerns when talking about school staff needs, we did see needs around, issues around staff burnout, around morale. We saw staff turnover. We saw needs to improve communication and transparency with the staff. Finally, we learned that schools found it to be very beneficial to have a dedicated external facilitator to support their school safety work. This role helps them to organize and plan meetings, to monitor their progress on what we're doing. And when schools are already so busy, it took some of the burden off of them, and it kept their school safety work moving forward. So a policy recommendation that we have in our study is to find ways to make these kinds of supports not just part of a grant, but something that is embedded into our school safety system. That is all I have for our lessons learned. I'm now going to open it up for any questions.
Okay, thanks a lot, Beverly, Sabrina. I think you have showed to us that, it's complicated, it's a complex to address the issue of school safety, but you have offered an approach that you call as the comprehensive approach to school safety. And we can see that, as you said, that this is a data-driven approach. And I believe that you have a lot of data, and you have shown us maybe just a fraction of the data that you have. But I think we have learned some of the lessons. Also, you mentioned in your last slide about the lesson learned. Yes, data is valuable, but data collection is challenging, and that we encountered that issue also when we did the first study as part of the adaptation in Indonesia, in Depok especially. Oh, kameranya. Oh, now we have mana nih kameranya? Oh, naik. Oh, okay. Oh, now the camera is. Hello. So we have two cameras in this room. I need to get used to with this technology. Two cameras because usually when we have a laptop we have only one camera. So yeah, it's very nice to listen some of the lessons from the implementation in the US, and now the Faculty of Psychology together with our colleagues from Banda Aceh, we are implementing an adaptation here. So hopefully maybe we can do like you did, Beverly and Sabrina, to maybe after or before this adaptation finish, we can also share the same data, the same presentation, lesson learned of implementing in Indonesia. Okay, so we have 30 minutes, 25, 30 minutes, 25, I think 20, 25 minutes for discussion. I hope it's okay, Beverly and Sabrina, to stay, because I know that it's evening in the US now. It's still morning here in Depok. So you can have questions, ask questions, comments. For those joining online, you can just write your comments or your questions in the chat box. No, nothing so far. Maybe some of you here attending on site, and we also have here Jody and Francisca. Maybe they can also join the discussion, the Q&A. Anyone? Mbak Dewi mau nanya? No. Baik. No? Oke. Oh, jangan. No. Kan moderator nggak boleh tanya. Sorry, Beverly. Sorry, Sabrina. I was speaking in bahasa Indonesia, in Indonesian language. Dimas, do you have questions, Dimas? Not yet. Oke, belum ada di situ? Kami, oh belum. Oh pancing, ya dipancing. Apa ya? Oke, ya oke. Ya, Mbak Dewi bidang mancing.
Hello, Beverly and Sabrina. Maybe it's okay if I sit here, yeah.
Ya.
Okay. My
Atau
question.
kesini lah Mbak Dewi. Oh nggak ada yang kelihatan, kelihatan lah ya. It's okay.
Sorry, that I didn't hear your presentation from the beginning, but I'm interested in knowing about the replicability of your study and findings into Indonesia. If I heard stories from
Jody, Francisca.
Jody and Francisca that they are doing this in Aceh, yeah. Your program in Aceh, but I haven't heard a lot about this. In your conclusion, I heard that you tailored the programs in every school. So there will be a different program in every school, probably to customize the intervention based on their problems. But then if you want to make these programs applicable country-wise or applicable universal, cross-cultural, perhaps to Indonesian culture, what would you do? Given that our culture is very collectivistic and probably for the safety of schools, parents takes probably a greater role in Indonesia compared to the USA. Do you get what I mean?
Yeah, that's a great question. And I can start, and then, Jody and Francisca are there right now to work on some of that. So I'm sure, and the team on the ground, Dimas and, Dickie, and I know there's one other person, I don't remember your name, but they're all on the ground there, can probably talk even more about that. But, one thing, like we said, it's a flexible or adaptable model. And so, there's going to be flexibility around the program selection. What we're doing right now is we're looking at the Blueprints evidence-based program list to see what programs on the list may be able to adapt, or even possible to adapt, and, to the Indonesian context. So that's one thing we're doing. And then we're also working on gathering a list of programs in Indonesia that also have research behind them that schools could select from. So what we did in the US and what we generally do is we basically have like a list or like a menu of different programs that the schools can select from. So it's not just completely open. And we want the programs to have some level of, ideally, of research behind them. I didn't present it in this slide, but sometimes I present about like the evidence-based continuum. So, on that continuum at the far end of strong evidence is going to be multiple randomized trials. Well, there's some programs the programs with multiple randomized trials are more likely the ones you want to scale, but there's going to be we don't have programs for every need and for every context there. And so there's going to be things that have maybe pre-post tests that show results that they're effective. And those we'll be looking carefully with you to see what gets on those program lists. So that's kind of from that programmatic lens. do you all on the ground want to help answer that question, or Sabrina too? I don't know if you want to add anything from what I'm saying first, and then we can go into the room.
Sure, I can add and then turn it over to Jody and Francisca. I think from a research perspective on the data side, we did a lot of work in terms of making sure the survey was relevant to the Indonesia context. A few things that I can point out that we did when we modified the survey was we had Dimas, the research team in Aceh and in Deepak, took the survey to the teams, asked them to read the survey. What aspects of the survey didn't make sense? A few things that come to mind are that we ask about ethnicity in the United States, because we do have a variety of different cultures there. That was not applicable in Indonesia. We replaced that question with religion. Another thing that comes to mind are the threat assessments that are not readily implemented. Beverly talked a little bit about these in Indonesia. I'm trying to think about some of the other things that come to mind, but Dimas and others might be able to share all the different types of adaptations we did make to the survey. We did we pilot tested the instrument on a sample of youth and staff, and ran reliability and factor analysis, and then shortened the survey and really made sure that it could be useful and adapted into the Indonesian context.
Okay, thanks Beverly, thanks Sabrina. Jody, do you want to add?
Thank you. I would just add that in thinking about implementation adaptations in general, there are a lot of underlying processes that we've developed as part of the Safe Community, Safe Schools model to facilitate school team, identify areas, data, help them think about what strategies to put in place. And I think that here in Indonesia, what we're trying to do is to really think about the what and the why. So what activities are we doing, and why are those important? The how part we need to adjust to the Indonesian context. So if we can really deeply understand the purpose of these activities and why we're doing them, and what the goal is with the school team, we can then think about what is the best way to do that with our Indonesian school partners. So we've been doing that thus far. We've already done in both places, in Deepak and in Banda Aceh, we did our resource mapping process that helps us to identify what current strategies they have in place. So when we look at the data and we go to put in a blueprints program or strategy, we ensure that it fits in with what they're currently doing. So I would say in both places, that process was really successful, and our partners here and in Banda Aceh were able to really adapt it to the Indonesian context. So we're learning together. This is new territory. This is our first international project, but I think it's exciting. And those are, in general, some of what we're thinking about when we're adapting for this context.
Thanks. Francisca, anything to add? No? Okay. Thanks. We have one online questions from Theodora. Just to let you know, Theodora is interested in replicating the research part of this project. So I think Dora, do you want to open your mic and then ask directly your questions, please, Dora?
Okay, thank you, Mas Diki. Hi, with Miss Beverly and Miss Sabrina. Well, I see this program is very interesting. School safety is currently very important, and I agree that there is maybe an external staff to monitor the program for the long term. And I was wondering, considering the school middle year is very short, then is there any way to shorten this program to have this? We can see this for maybe just for 2 years, maybe for the implementation for just 1 year, and then we can evaluate it because in Indonesia the middle year school is only for 3 years, and that is a very short time to implement this if we have to 4 years program.
Yeah, and it's okay. It's okay. So it's, I guess what we're talking about is when I'm saying it takes 4 years, it takes it can take that long for the school itself to really get their implementation of everything up and running. So, but once they have that, they're going to be more in sustainability mode. And it's possible that it also could be not take that long, depending on the complexity of the program that they're doing. So, you know, they could be doing a simpler program that's maybe not school-wide or is maybe at one grade level. And yeah, there's ways to make that work totally in the middle school so yeah, it doesn't have to be, I guess it just takes a while to make change in systems. But then it can be sustained over time. And then the kids that go through the middle school years will have this high quality, safe school environment. So I'm hoping if that makes sense to you. There was something else I was going to say about it. But Sabrina, do you have anything to add there?
Yeah, I totally understand. So that a youth that goes in at 7th grade, they'll get, 3 years of the program. But what we're talking about is that it often takes, a full year to really work with the school, administer survey data, identify have them work with them to prioritize their challenges, and then think about implementing some strategies. And that can take a whole other year to do. And so, and then they start to really work on implementation, and implementation can take a couple years. So it's really about the school and the school team implementing the Safe Communities, Safe Schools program for over, for up to 4 years before it's fully implemented in the way that we'd like to see it, if that makes sense.
Yeah, like this, I think you can think about the Safe Communities, Safe Schools model as like a planning process, or, a process that this happens at the school level. And then the different programs students get while they're in the school during that time. And the other thing is that, we did the study on middle schools, and that was really intentional because we wanted to, that middle schools aren't so big like they are, like high schools are in Colorado. So it seemed manageable. And also that's when, violence and some of those more troubling behaviors begin at that adolescent time, but they're not as ingrained. And so we felt like that was a real important transition time for children. But the Safe Community, Safe Schools model can be done in elementary, middle, or high school. We have a project right now where we're working with schools throughout the state of Colorado, and we work with any of those grade levels. So it's more thinking about that planning process and that way of strategically looking at data and putting into place effective programs that can happen at any of the school levels. So ideally, students are going to get those kinds of supports throughout their whole academic career. That would be the dream.
Okay. Thank you, Dora. Any follow-up questions maybe from you, Dora?
No, Mas Diki. I think it's. I agree with Beverly. If we can implement it on the any level from primary to high school, maybe it more wonderful.
Yeah. Okay. Maybe after we finish this 5 years with junior high school, then maybe we can think of maybe go to the lower level to the elementary school, or maybe to the higher level of the senior high school in Indonesia. Who knows? Yeah. Fingers crossed. Okay. What we need to get things done in 5 years. Okay. Any? Okay, Dimas, please.
Okay, thank you. It's interesting to see though I'm working also with this program, but I was fascinating about how Beverly and Sabrina present about your paper, that ask three research questions, right, about the effects of the SCSS in the US, and I found that you see that as we know, when we want to look at the effect of the implementation or any intervention, there are lots of variables that affecting that intervention, especially when we compare the intervention lasting for 1 year, there would be a lot of variables that affecting that effects, right? And I just wondering how you control that variables, and how do you measure the effect size? Because I also see your paper, Beverly and Sabrina, you didn't measure the effect size, right? And I just want to make sure, just want to know how you be sure about that increasement of the increasing of the variables that you mentioned is because of the SCSS model that you developed. Thank you.
Yes, thank you, Dimas.
Well, I can start trying to work on this question. So I'll also say that we had external evaluators as well working on us. So that one paper that's the effects was the first author is Alison Dibnicki, and Sabrina and I did not do those analyses and stuff. I was the PI on the study, but that was subcontracted out. So I will do our best. But first of all, one way that you control just in general is that we did a randomized trial. So that by doing a randomized trial, that that's one of the ways that you can tell that this is what you could see from the intervention compared to not having an intervention. But there were also different control variables put into the models, but I just don't have that off the top of my head right now. And we certainly, Dimas, if you want to get more information about that, we can get it. We can either look at it together in the paper, or we can get it from our evaluators. She would love, I'm sure, be very happy to talk about any of this. But I don't know, Sabrina, do you want to add any more?
I don't think I have anything to add. I can't remember exactly what we controlled for, but I would agree that the randomized control trial is the reason that we would expect to see differences between the intervention schools versus the waitlisted control.
Okay. Yeah. Any follow-up, Dimas? Follow-up comment, maybe?
Okay. Yeah. Thank you. Just randomized control trial. Yeah. Because I also know that this is kind of the golden standard on how to get the effect of the intervention or manipulation that we have. Asking this because we also going to write the same paper like you, right? So just want to make sure that we are in the same standard and the same page. So yeah, thank you very much.
But Dimas, we're not going to have a randomized trial for Indonesia. You're going to have pre-post data. So those questions, some of those questions, we're not going to be able to answer the same way. But the study that we're doing in Indonesia is a lot about looking at, adaptation, and ideally you'll see improvements from the school in their pre-post data over time. And then those kinds of things would suggest that, hey, something good is happening, but you don't have those same controls that you have when you do the randomized trial. But you don't want, Sabrina and I talk about this all the time, you don't want to do a randomized trial until you have all the program stuff worked out. And in some ways, you know, our Safe Community, Safe Schools model, you know, it started after Columbine in 2000. So it's been around a long time, but we keep revising, trying to make it even more and more relevant for schools. And so when we got this grant, we were doing a lot of planning at the same time as we were doing a randomized trial. So we wouldn't recommend that. You know, ideally, you've got more worked out before you start that randomized trial. And that was maybe that could be another lesson learned, but that's just I mean, we also felt like we wanted to give it a try and see what we could see, you know, at that stage. Cause we also didn't know, you know, it was like, maybe we could get results after that short of an amount of time. That was, I guess, almost like another research question. Is it possible to do whole school change in that short of an amount of time? And I mean, I think the answer is no. You know, that's what our results say. You need more time to do that, which is, again, in line with the research. But I think we held out that hope, and we all worked so hard to try to do that.
Okay.
I think the only other thing I would add is that it's really important in Indonesia to track the milestones and benchmarks for your implementation of Safe Communities, Safe Schools, because that will help you understand, you know, the effects of what it is that you're doing. If you see changes over time in school climate, and you've implemented the model as intended, then you're more likely to be able to say that it was because of that, if you track the implementation.
Okay.
Yeah, one other thing we didn't really talk about in the presentation, so one of the reasons we make such a big deal about putting in place a blueprint program that has, you know, these multiple randomized trials behind it is because those programs have demonstrated effects that are proven. And so the idea is, if we implement those programs with fidelity, we should get those same results. And so where we were challenged is that we did get those programs, you know, at least started, but they weren't at that full level of implementation to get those effects. We think that it would just takes longer. You could see some of the challenges we had with implementation. But the idea is, if you're using something that you already know is effective, it should get those results. And so that was the logic behind what we're talking about. And I really believe we would if we had, you know, if you were able to implement them with fidelity and do that over time.
Okay. Thank you, Beverly. Thank you, Sabrina. Maybe if there is maybe one last comment or questions, online or offline. No? Okay. It's now 2022. So yeah. Thank you so much, Beverly, Sabrina, for joining us online from the US. And thank you, Jody and Francisca, joining us here at the Faculty of Psychology. And thank you for all joining us online, and also Mbak Ike, Mbak Debbie, joining us here from the Faculty of Psychology. It's been a privilege, really, Beverly and Sabrina, and also Jody and Francisca, not just reading your paper, but also to have you to share with us in you know, live presentation like this. And for us, especially the implementation team here, the adaptation team here in Depok, we have learned so much through this presentation this morning. So I think by by that statement, I'd like to finish this presentation. Once again, thank you for all joining us. And this is not the last research day, research presentation. We have a regular one, monthly research talk organized by Debbie and her team, research and community engagement unit at the Faculty of Psychology. Thank you. Good morning and good evening. Bye.
Thank you, Dickie. Thanks, everyone. Bye-bye.
Bye.
Thank you. Bye-bye.